afternoon. So I'm going to talk about mLearning in developing countries, and I'll be talking specifically about my experience with the health sector in Tanzania. So this is basically the outline of my presentation. And just a question, has anybody here been to Tanzania or no? Okay, so this is where it is. It's a country about 13 times the size of Ireland in sub-Saharan Africa, and it's listed by the United Nations as one of the 48 least developed countries in the world. So I first went to Tanzania back at the end of 2012 when I was working with the Global Health Workforce Alliance at WHO in Geneva. And the reason I went was because of people like these. So health workers who are posted to facilities in remote parts of the country where they might be the only person working in a facility. So very often they're under huge pressure because of understaffing, and also because Tanzania is a country that struggles with some major diseases like malaria, TB, HIV/AIDS and so on. But it's not just the shortages and the understaffing that's a problem, because very often health workers are sent to parts of the country where there's no electricity. Maybe they don't have the equipment that they need to do their jobs properly, and even often they don't have the essential medicines that they need to treat their patients. So even just looking at this picture, it's not hard to imagine or to understand how so many people in Tanzania, so many health workers, feel overwhelmed and, in a sense, just unprepared to do the work that they've been trained to do. So people talk about a sense of isolation and just no pathway to progress in their careers, just alone. So it's really in this context that in Tanzania continuous professional development is so important, and not just so that health workers can update their knowledge and skills to perform better, to provide better care for the communities they serve, but it's also important to give them an opportunity to connect with their professional community so that they can share experiences and really try and figure things out better with a community of people who know exactly what it's like to be working in these conditions. So, I mean, there are courses available for CPD in Tanzania at the moment, but there just aren't enough. And part of the problem is that the main model of training is the training model, the off-site workshops. And just talking to people in Tanzania and from research that's been done in this area, it would seem that this isn't really the most appropriate model for a country like Tanzania. The first reason is that the costs are way too high because it's not only the tuition fees that are a cost to factor in, but very often people, like we saw on the slides before, might have to travel long distances on very bad roads to get to the training venue. So then you also have to factor in other costs like meals, accommodation, per diem payments. So this really bumps up the cost of this type of training. But also remembering that Tanzania is a country that suffers from massive health worker shortages. This is another reason why it's not the most ideal form of CPD, because a health worker who's at a training course isn't obviously at their clinic, and sometimes these clinics are further understaffed for maybe 3 to 5 days at a time. Another issue in Tanzania, like in many developing countries, is that very often, not always, but often courses are funded by donor organisations who have their own priorities. So what we have been told is that while these organisations very often offer very good courses, they're not always matched up exactly with the most urgent needs or priorities of health workers themselves. So this is a little bit of a problem. So, as I said, I first went to Tanzania in 2012, and I've been there about 10 times since then. And the reason I keep going back is because I believe that something can and should be done to address this problem. And the reason I think that something can be done is that people now have mobile phones. So still in Tanzania, the situation is that the majority of people in remote areas have very basic 2G phones. So like the phones that most people here had maybe 20 years ago, that you can make a simple phone call to friends and family, send an SMS, this kind of thing. But what's been interesting to see in Tanzania, and I know it's happening in other developing countries as well, is how people are actually using these phones for more. So they're using them to solve bigger problems as well. So already you can imagine how somebody who has a mobile phone, how life-changing it is for them to be able to actually connect with friends and family far away, because most of these people never had a landline. But there's another use that's becoming more widespread in Tanzania, and people are using it for mobile banking. So again, this is another life-changing thing, that people who never had a bank account can now suddenly make and receive payments just using something the size of this. And another use that's been given to them is a lot of organisations have started developing SMS campaigns. So they're sending out critical information to large groups of people in a way that's fast, and in a way that just couldn't be done 20 years ago. So the point is that mobile phones are being seen as a tool for development, much more than just something that's handy and convenient. It is something that can help people in Tanzania to leapfrog years of development and catch up with the rest of the world. Now, obviously, there are limitations to how much you can do with a 2G phone, but the situation in Tanzania is changing, and it's changing really fast. So there are now more and more people connected to the internet, and also there are more and more people upgrading from the simple 2G phone to smartphones, and they're also investing in tablets. So obviously this is a really great opportunity for mobile learning. So for the last number of years, I've been working with these organisations in Tanzania. Our national coordinator is the Benjamin Mkapa Foundation, which has very close links with the government. We've got the two main professional health associations in our group. The top university for health education in Tanzania is also with us, and the Tanzania Training Centre for International Health, which is a public-private partnership set up by Novartis Foundation and the Swiss government. So we started off a number of years ago with a very basic idea that, okay, we'll set up an e-platform for health workers, run short courses, maybe the equivalent of a one-day workshop. So we started with this idea, and really, you know, it was very tempting at the beginning to say, okay, we'll just build a nice-looking platform, we'll start shooting videos, making some MCQs and get going. But we really felt that this wasn't the approach that was needed in Tanzania. So we felt that we needed to explore a little bit more and really understand how our solution would be of value for the people we wanted to help. So this, I guess, was a longer route, and it's taken about 5 years to get to this point. But I'm just going to tell you a few things that we did to get to where we are today. So first of all, we did an initial exercise to map the key stakeholders in Tanzania and reach out to engage them in discussions. So the reason we did this was that we felt that while we were proposing a digital solution, that this would really have no value if it wasn't firmly integrated in the analogue ecology of health workers. So the purpose of reaching out to stakeholders, and by I'm talking about people at ministry level, professional health associations and councils, donor government embassies, universities, training institutions, and a long list of others, not only in Tanzania but also at global level through several meetings and discussions with the World Medical Association, the International Council of Nurses, and so on. So the purpose was to really have a collaborative process so that we could together identify the real needs that the platform would address, and also to ensure that there was greater ownership, that people could identify a role for themselves moving forward within the platform. The second area was that we knew that we were lacking expertise in how we would actually go about building courses for the platform. So, you know, there might have been a very quicker route to getting this knowledge, but I decided to sign up for a master's in blended and online learning, which I've since completed. And one of the reasons I did this was because there was an opportunity to do some research in the area, and my dissertation really has proved to be useful for the group. The third thing we did was, or the third need that we knew we had, was to find affordable ways of making courses, because we're aiming to run courses for all cadres of health workers. So this would mean that in a group of about 75,000 people with different cadres, we knew that we'd have to build a lot of courses, and we had to find an affordable way to do it. So last year I was really lucky to meet Brian Mulligan here at IT Sligo, and he was coordinating a project funded by the European Union, developing and testing low-cost methodologies for making MOOCs. So I worked with Brian on this project, and what we learned during this project and some of the outputs from it are now key part of the initiative. So just the key findings. So from the activities, we learned that there is most definitely an appetite for using technology for training in developing countries. We learned that it's just so important to link with other initiatives in Tanzania. So, like in many developing countries, there are a lot of organisations doing a lot of programmes, and we really learned that we need to connect the dots between all of these organisations and build the platform as an infrastructure that can be used by other organisations to run courses that they've developed already or they want to develop using our e-platform. So the third one is, again, that there are a lot of resources out there, a lot of courses have already been developed, but if they're not relevant to a local context, then there's no point putting them on the platform. So we can, of course, use the resources that are openly available on the internet, but where necessary, we will need to use these low-cost methodologies to build courses in Tanzania. The fourth, and not surprisingly in a country that's relatively new to ICTs, we will have to make massive efforts to build digital literacy skills, but not only, of course, teaching people how to press buttons, but also to really learn how to be effective members of a platform and confident in a mobile learning environment. The fifth point here, that there are many countries who are making CPD mandatory, and Tanzania is one of these countries that is bringing in new legislation to make CPD in health compulsory. So we also found out that we need to find ways to make courses contribute to implementing this legislation. And finally, we learned that the platform must be locally owned. So there are three things here. That first of all, the composition of the consortium of this programme is predominantly Tanzanian. The purpose of our outreach was also to ensure that there would be greater ownership locally. And the final one is that the locomotion project that was coordinated here at IT Sligo, one of the outputs of this was a MOOC showing people how to make MOOCs on a budget. So this is a really great resource that we can now use for the future as part of capacity building for organisations in Tanzania to build courses that can be delivered on the platform. There was a couple of questions that I asked in my dissertation, and they're quite interesting. First of all, I asked people their views on different models of CPD. So the majority of people said that the workshop model or off-site training was best for new knowledge acquisition and skills. And for all the other purposes of CPD, coaching and mentoring came out tops. And then I asked them in this table how they would rate the digital equivalents of CPD models. And all of them basically were rated quite highly, though there were some preferences for some models. Sorry, just this one. Okay, so now from a very basic idea of just creating a platform with courses, we've built out our concept in a more detailed way. So now we are ready to start work on actually implementing, and we're expecting to have funding in place to actually start this implementation stage in January 2018. So now the difference is that we have now planned to make the platform using a mobile-first approach, so designing for small screens and also having downloadable elements so that people can view some elements offline. We'll use low-cost methodologies to develop a high number of MOOCs and work very closely with professional associations to ensure that people can get credits they need to show CPD compliance. A lot of efforts will go into building communities of self-directed learners through digital skills building programs, learning to learn programs, and also campaigns just telling people about the use and the value and the benefits of being part of this mobile learning platform. And then also the platform will be used as a space where people can connect with others to share experiences and to solve problems together, and also establishing agreements at international level so that we can do mentoring and coaching internationally. And I just want to leave you with 3 key messages. So SDG 4 was already mentioned about online learning or about CPD, but target 9C of the Sustainable Development Goals is really important, and I'd like to read it. So it's significantly increase access to ICTs and strive to provide universal and affordable access to the internet in least developing countries by 2020. So really the point is that digital transformation has already started in developing countries, and the numerical objective of this target 9C is to connect the next 1.5 billion people by 2020. So this is the reality. There are a lot of people going to be coming online who need services, and now we can provide services in this way. The second point I want to make is that while I'm not saying that other forms of training need to be abolished, what I am saying is that in developing countries, mobile learning is the only option to provide sufficient amounts of training for professionals, because it's more equitable, it's more affordable, and it's more sustainable than other models. And finally, you know, it's very good to talk about technology, and yes, technology is key, but CPD is still about people. So the massive efforts need to be made to make sure that people are ready to function effectively in mobile learning environments. So they need to be supported to maintain e-journals, to reflect on their learning and how it can be used in practice, to be supported so that they're confident members of discussion forums, that they know the value and know how to exchange experiences, exchange knowledge, and really discuss how they're implementing their learning in practice. And finally, they need to be also supported to build e-portfolios, not just so that they can document their lifelong learning, but also so that they can provide evidence to governing councils that they're in compliance with CPD regulations. Thank you.
I pulled out, the Ernest Boyer quote, and I'm sure many of you have seen this before, on the nature of scholarship. And one of the things that I saw when I was at this conference the last 2 days was, the nature that Boyer said is, that it's time to stop thinking that professors are just in the ivory tower doing things that are only about their interest. And he says it's the scholarship of discovery, the scholarship of integration, the scholarship of application, and the scholarship of teaching. Well, I saw evidence of each of those four things in all of the presentations I went. I'm thinking in particular, and I don't know if I see her, the woman who's working from Sligo, who's doing the work in Tanzania. I would have had the pleasure to go to her session. She's doing really great work with mobile devices. And it's not that it's really about the mobile device. It's about the very talented work between the instructional designer who's working with her and figuring out the way that she can reach education for solving the very important problem that she has. So she has the nature of discovery, she has integration, she has application, and scholarship of teaching.